Good afternoon, students. Today we're going to be talking a little bit about suturing technique. First thing that we're going to start with is to learn how to hold the needle driver or the needle holder. It's not a hemostat, it's a special instrument that's used to hold the needle. And so basically you're going to start by placing your thumb and your fourth digit into the rings. Put the third digit sort of right in this little crook, and then the index finger right on top. The little finger can just sort of hold over here on the ring, and basically this is called the tripod grip. This is what you're going to use for not only the needle driver but scissor technique or cutting technique. It's important not to put your fingers all the way in the ring holds. Some people actually suture by holding the instrument outside of the ring holds, but I highly recommend that you just put your DIP in. It gives you really great control. So this is the tripod grip. The next thing that we're going to do is actually learn to load the needle, and there are a number of different things that we're going to do to make sure we're sort of in the best position. Of course, we're going to modify depending on the size of the bite that we're taking, the size of the suture, and those kinds of things. But in general, a good way to go ahead and at least start to load your needle is if you, and I'm actually for the purposes of videotaping holding this up, but the best way would be as if this were lying flat and you'd actually come straight down onto the needle. It's very stable. So we're going to just kind of hold this up so that you can see, and basically if you come straight down and you're actually holding the instrument as if you're shaking the hands with an instrument. So in other words, I'm not going to come down and turn around this direction. I'm going to come down as if I'm shaking hands. That's important. Once you grasp the needle, and you can go ahead and pull the needle out and the suture material out, and what we're looking for here are a number of different things. We're looking for and this is all for a right-handed clinician, so everything is sort of reversed for a left-handed clinician. But the needle is at the tip of the instrument, okay? So in other words, when we loaded it, we weren't in this position. Okay, we're at the tip of the instrument. The other thing that we're looking for is that we're perpendicular, okay? We're not really oblique here or here, so we're perpendicular. The point is toward our non-dominant shoulder or the left shoulder. And we're loaded up at about the distance between the, if you think about this needle being in thirds, if you were to divide it in thirds, this is the proximal third, and then the middle third, and the distal third. We're at the junction between the proximal third and the middle third. Of course, we're going to choke up toward the point if we're taking a smaller bite, or we'll actually choke up or actually go more toward the swedge. Here's the swedge end if we are taking a larger bite, but in general, about at this junction is a good starting place. Okay, so we've got the concavity is furthest from us, and if you just memorize this position, this is a good starting position. If you're having difficulty, I really encourage you not to touch your needle, but instead to use your forceps to adjust the needle into place. The other thing is if you're really having difficulty, you can just drop the needle down as if it looks like a smiley face. And I'm not sure if you can see this, looks like a smiley face, and the point again is toward your non-dominant shoulder, and if you come straight down as if you were shaking hands and pick it up, you'll be again approximately in the right location. Then you can adjust if you need to. Okay, I'm trying to get as close to the end as I can. Okay, so that's the position of the needle driver and the needle within the needle driver. The only thing that you have to worry about with regard to the FourStep hand is that some of you are going to naturally just hold it like this. If you cannot see the butt of the instrument, this is incorrect. So you want to try to see the butt of the instrument is this part up here. You're holding it like you would if you were writing or if you were holding chopsticks. This is the best control. You have the best functional ability this way, so try to really avoid holding in this position. That's the only thing you have to remember over here. The other thing is there are very, very small teeth here, and you want to overly, you don't want to overly traumatize the tissue that you're holding. So what a lot of students do initially is they kind of are suturing one-handed, but remember you have another hand here that you're going to hold tissue to give some counter traction so that you can actually pass the needle through the tissue easily. So use this other hand if possible. What we're going to go ahead and do is a simple interrupted with an instrument tie. A couple of things that we want to look at. Here's our laceration. It's nice and linear. In the OR setting, we oftentimes are going to suture in this direction. But in the ER setting, it's fine if you kind of orient your body in line with the laceration. Some people like to start at one end and suture toward themselves, and that's fine. Other people like to start in the center and do what's called the rule of halves. So the first suture would be placed halfway through the wound, and then we would half that by placing a suture here, and then we'd half the next segment. So one here, 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 and basically the idea is you'll avoid an unevenness. If you were to start at one end and suture toward yourself, there is a possibility that if you keep taking too much on one side versus the other, you'll get something called a dog ear at the end, which basically will end up looking something like this. So you're suturing along, things are going great, and you find out that you have more tissue on one side than the other. If that does happen, what you should do is take everything out and start over. Occasionally, no matter what you do, the wound is just going to do that, and there is a way to correct it. But to avoid that in the first place, doing the rule of halves is probably a good idea. So we're going to start halfway through. The other thing that we're going to do is really pronate back. What I find a lot of students do is they try to force it with their arm, and really, if you think about a supination maneuver, if you're turning a doorknob, that's what you're trying to accomplish. I'm going to go ahead and use this FourStep hand to kind of hold the tissue. You're going to try to enter as close to 90 degrees as possible, which is basically straight up and down. So you want to avoid coming through at an angle like this, but really as far as possible, straight up and down. And we're going to go ahead and come out, and you notice where we came out here, obviously this would be connected down below, but we want to come out not underneath the laceration, but at the very lower portion. If you can take this all in one bite all the way across, you then go ahead and do so, but a lot of times you'll find that you'll bend your needle and you'll force your needle. So a good thing to do is about right here is actually reload halfway through, so you can actually pull this through and reload, same place that we had talked about before, and you're going to try to enter at that same distance and come out approximately the same distance. From here to the wound is from here to the wound, should be about the same. And the place that we went across was at the same level, not too high or too low. The other thing you want to do is avoid grasping the tip of that needle. It will dull it. So we're going to grasp down here, and we're going to go ahead and pull all the way through, and we're going to leave about an inch of the tail and just drop the needle down onto the field. It won't cause any trouble. This is a sterile field. The reason that we pulled it almost all the way through is if we left a big long tail, all of this is going to be cut off and get wasted. So you really want to try to maximize your suture, because we're going to try to get some more stitches in with this particular length of suture. Next, we can go ahead and drop our FourStep down, and what you're going to do, there's a couple of steps here. This is called an instrument tie. What we're going to do is go parallel with the wound here, and we're in between the two suture ends. So you're actually in between. What I mean by that is this is not in between the two. This is behind. This is behind. We want to be always in between. We're going to go over 2 times. The reason we're doing 2 times is because we really want this to hold well, and we're placing a surgeon's knot as our first knot. We're going to grasp the tip of the suture, and we're going to trade sides. So the little side is coming over here, and the long side is going over there. So you can see that, and we come down exactly perpendicular to the wound, okay? And we're going to follow those 3 steps again. So we're in between the 2 suture ends, over just 1 time this time, grab the tip, and we're going to trade sides. Make sure I get that. Trade sides. You see the nice circle? We're going to trade sides. That's 1 knot. We're going to go ahead and place about 3 knots. In between, over once, grab the end, trade sides. In between, over once, grab the tip, trade sides. That's 2 knots. In between, over once, grab the tip, trade sides. In between, over the top, trade sides. At the very end, we're going to pull the whole thing over to one side. It's already kind of on this side, so we'll put it over there. The reason being, we want the knot to be not above the laceration, because seepage and everything can actually get into that knot and cause trouble. So if you pull it over to the side, this is where we're going to go ahead and put all of our knots on one side. We're ready for the cutting technique. And what you want to do is, again, hold the scissors as if it's the tripod grip that we talked about before. There's actually a little screw here on the scissor. That means the scissors should be in this position rather than this position. It's just the way the scissors are manufactured to cut. It's not a big deal in the ER setting, but in the OR setting, it's just good technique to always pick up the instruments in this. If you see that little screw, that's meant to be up. We're in the tripod grip. You're going to actually open the scissor tips, but not excessively. Only open as far as what you need to cut. You can put the two ends together. You're going to actually slide down, turn 45 degrees, and cut. Okay, so basically the steps are, if you were holding longer suture, you would actually go all the way down 45 degrees either that way or that way and cut. Okay, and that's the way that the scissors cut best. That's the only technique that you need to worry about with the scissors, is hold it correctly, slide down, only open as much as what you need. Try to cut with the tips. So in other words, you don't want to be cutting something right in here. You want to really just be cutting with the tips and only cut what you can see. If you're in an OR setting and you're very deep down, you could inadvertently get in too far and be cutting something distal. So tips is best. Just even in the ER setting, it's a good rule of thumb just for good technique. And now we're ready to go ahead and place another simple or interrupted. So we're going to go ahead and load up again. So we're going to get our smiley face where it's pointed to our left shoulder. Come straight down as if we're shaking hands. We're going to grasp it in that same location. We're perpendicular. We are at the tip. Concavity's furthest from us, pointing to the left shoulder. And we're going to go ahead and use our FourStep to open the wound up so we can actually see where it's coming out here. We're going to grasp, but not at the tip. We're going to pull it through, reload, and use our FourStep again to go through. And again, not grabbing the tip. Pull it all the way through. So we have a little bit of a tail here. Put our FourStep down, and those steps are going to be, again, in between, over twice. Now, why do we grab the tip and not way down here? You'll find if you grab way down here, you're going to get hung up on yourself. So you try to grab as close to the end as possible. And the short one and the long one trade sides. And notice that I'm coming down perpendicular. I'm not coming down this direction. I'm not coming down that direction. They trade completely. That's important. So in between, over once this time, because we don't need to do it twice except for on the first throw. And we're just going to keep repeating those steps. And probably 3 to 4 knots is adequate. And at the very end, we'll go ahead and pull the whole thing over, and we're ready for cutting. So that was your simple interrupted with an instrument tie. Next, we're going to do a vertical mattress. Vertical mattress is excellent for deeper wounds. It's a wound that you want to close not only superficial but deep. So we're sort of simulating this is a really deep wound. Another name for this one is the far, far, near, near. And we'll go ahead and jump over and do this laceration here. And so what we're going to do is a little bit further away from the wound edge. We're going very, very deep, as low as we can, but not underneath. Definitely have to reload through halfway through on this one. Okay, because if you try to take it all in one bite, it's too big, way too big. And we're going to come out again quite a bit further from the wound edge. Okay, now this is where it changes. We're going to pull this almost all the way through. We're going to load up backhand. And backhand is where our smiley face is pointing to the right side now. If you think about tennis, this is forehand and this is backhand. So we're going to load up so that we're actually going backhand. So this was forehand. We're going to load up to go backhand. And we're actually going to load up a little bit toward the point, a little more, maybe about halfway. The idea here is we're going to go near, near, so we're going to be very near the wound edge. Sometimes you can take this one in one bite because it's fairly small. And we're avoiding that tip as best we can there. Okay, so we went far away from the wound edge to far away, then we went near to the wound edge and came out near to the wound edge. And you notice the near was much more superficial and the first one was much more deep. So you're actually closing 2 layers and you're avoiding dead space. So again, a very deep wound, this would be a good a good stitch for that. We're going to drop our forcep down and we're going to do our instrument tie again, just like before, parallel with the wound in this case, in between the two. Now there is another technique where people kind of go over and back and do all this kind of stuff. If you just stick with this, it'll always be correct and you'll have really great square knots. Again, the surgeon's knot is the first one, and then all the others are square knots on top. So we're in between, we're going to go over twice, grab the end, and we're going to trade. In between, over once, grab the tail and trade. So there's one knot. And let's place about 3 here with our instrument tie, just like exactly like before. And on this one we don't have to adjust it where we pull it over, it's just going to stay right there. Get ready for our cutting technique. And this is how it will look on the top. You're going to see sort of a linear line here and then this other linear line, and you'll have that all the way along. Now, what if we had to take these sutures out? Notice, let's say we were going to take this simple interrupted suture out. You wouldn't want to just clip halfway between and then drag all this dirty tail all the way back through our wound. You would want to try to clip as close to the skin as possible here. And sometimes a number 11 blade is easier than getting scissors under here. You can just slide a number 11 blade underneath here and clip that. Now you can see the top part is free, and when you pull on the knot, you're really not dragging a lot of the suture that's been there for a week or so through the wound. On a vertical mattress where you're going to cut these out, you're going to actually clip it here, and you're going to attempt to get it as close to, and it might be difficult, but right here. So you can see again, you didn't want to just go halfway through and drag tail from this side through and tail from that side through. When you grasp this, you can just pull the knot and what was inside comes out. Our last one that we're going to do here is our horizontal mattress. This is not used near as common as the other two, but it does have a place. It's excellent for a wound that has a flap. So if you think about maybe somebody has a laceration where there's been sort of a side swiping and there's a flap of tissue and you're trying to pull the flap over. The thing about this simple interrupted, there was tension equally on both sides. With a horizontal mattress, we're going to actually pull one side over toward another, and you'll see what I mean by that in a moment. We're going to load up exactly the same way. Here's our smiley face pointed to the left side. We're going to come down like we're shaking hands. Memorize that position, double check, make sure all those things are in place, what we talked about before. Holding our forcep correctly, we're going to go ahead and open up the wound edge so we can see where we're coming through, and we are going to go ahead and reload halfway through here, so we'll go ahead and just pull a little bit and reload right there. Okay, now, and always be conscious of where your fingers are so that you don't, for instance, I've seen a lot of students kind of hold like this and they're forcing through, and if you watch, their needle could end up poking themselves right in the finger. So stay out of your own way. Use the forceps to help you, but don't, make sure you know where your fingers are. We're going to go ahead and pull this through just like before. We're going to go ahead and load up backhand again. So we need to load up with the smiley face going toward the right. And we're going to be fairly far back toward the, again, this part is called the swedge or the swage. And we're going to go backhand. That might be a little too far back for me. What we're going to do is go next door. So what I mean by that is before, this was a simple interrupted. If we stopped here, we'd be done. If we continued with the vertical mattress, we'd go near, near. But what we're going to do is go next door and come out. So it's going to look like a square, almost like a box. And I'm just going to adjust how I'm holding here a little bit and try to see where I'm coming out. This might be a little tricky. I'm going to reload again right here. Use my forceps to hold the tissue up if I need. And you can use your, your forceps really are here to help you. We're going to try to avoid touching the very tip or the point. Okay, and when we pull this, there we go, and make sure we didn't get too much of our tail there, you'll see that we have something that looks kind of like this, like a little box. The idea here is we're going to pretend this side is relatively avascular, and this side is very vascular. So you start on the vascular side, you go to the avascular side, or the flap, and what we're going to do, the idea is to pull this over that direction. This is going to pull it over. It's not equally distributed like the simple interrupted, but we are at least in the horizontal plane. Before we were in that vertical plane, hence the vertical mattress. This is all on the same level, so this is going to be the horizontal mattress. We'll drop our forceps down. Now what's different here is before we were always parallel with the wound with our instrument. Now we're going to be perpendicular with our wound, and the reason for that is we're just trying to go in between our suture ends. So you can see I'm in between my suture ends if I'm perpendicular with the wound, and everything is the same. So we're just going to go over 2 times. We're going to grab the end, and now they trade sides, but they're coming this direction, so that's parallel with the wound. And we go in between over 1 time, grab the end, and trade. There's 1, and we'll do a few more of these same steps for the instrument tie. And the last one. Okay, and then we're ready to cut. Okay, the idea is you see that this one looks a little bit different, and you should be able to recognize from the top if it was a simple interrupted, if it was a horizontal mattress, or if it was a vertical mattress. Now when we go to cut this one out, again, the same sort of rules applied. If I were just to cut it halfway through, I'm going to be dragging all this stuff that's been outside to the world through the wound. I want to avoid that, so I want to go as close to the skin as I can on that side, and as close as I can go on this side, and then I'm just going to simply grab the knot and pull. Okay, so those are our simple interrupted vertical mattress, horizontal mattress. At this point, I'd like to go ahead and show you some stapling technique. And as we talked about in class, staples are utilized frequently. They heal very, very well. So just for a moment here, I'm going to get my staple gun. Oftentimes in the OR setting, there's an everter, and the person who's an everter is going to have 2 forceps. Oftentimes the surgeon likes to be the everter, and the first assistant gets to control the staple gun. But the idea, and the pig is very difficult to try to evert, but essentially I'm going to start far away and I'm going to come toward myself here. And if you'll notice really carefully, I'm not sure if you can see this, but there's 2 teeth and 1 teeth on these forceps, these little Addison forceps. This one happens to be smooth and doesn't have teeth. But the idea is you don't want to, grasp the tissue so strongly that you're leaving little marks. You want to just really try to hold the tissue up as best you can. With the pig, you are going to have to squeeze a little bit, and it is difficult to evert. But the idea of eversion, I'm not sure that I'll even really be able to demonstrate it. You're going to grasp on either side and just turn upward. That way when the person who's coming along with the staple gun staples, it'll end up with the tissue stapled up in this direction, and that's called eversion, which is great because over time it's going to flatten out and it'll leave the best possible cosmetic result. Whereas if you start with it straight across, it tends to depress a little bit, which will cast a shadow and the wounds are more noticeable, or the scars more noticeable. So what I'd like for you to do in class is that I want you to practice being the everter as best you can. So you're just going to sort of hold and the person staples. You're going to hold and evert and the person staples, and you're just going to do that a few times. The person who's the stapler is going to be going along, and I'll just pretend, I guess, from this direction. This is the staple gun. There's different ones. Sometimes they have a rotating head, but essentially once the person is holding and everting, you're going to line up the little arrow with the wound, and you're just going to simply, and again, the pig does not staple quite as well as human skin does. You just sort of press down, squeeze, and you get the idea of how that might look. And this is about the distance that you would go ahead and utilize that. Then once you go to take these staples out, there are a number of different little devices that are utilized, and again you can see that you may be able to see there's sort of like 2 teeth and 1 tooth. Usually the 2 teeth go down underneath, and the idea behind these staples, they go in and they bend. And so the first time you push on that little instrument, it straightens them out, and then you can pull back and they come straight out. Whereas if you do that step simultaneously, where you're actually straightening and pulling out, you're going to tend to pinch and hurt the patient. They're going to jump a little bit. So it's a two-step procedure. You put the instrument underneath, squeeze, then pull up. So squeeze, pull up. Not at the same time. So for instance, you don't want to go like that. You can actually even hear that hurt a little bit. So it's a squeeze, then pull up. And so everybody should get an opportunity to be the evert or the stapler and to remove some of the staples.